Hi, today I want to walk you through one of the most important decisions you'll make when you turn 65. Alex is turning 65 in just 3 months and has one big question: when do I enroll for Medicare benefits? The most important thing to know is your Initial Enrollment Period, or IEP. This is a 7-month window that surrounds your 65th birthday. It starts 3 months before the month you turn 65, includes your birthday month, and extends 3 months after. Here's the key. If you sign up in those 3 months before your birthday month, your coverage starts the first of your birthday month. No gap. So ideally you want to enroll early. Let's talk about Part A first. Part A covers hospital stays, skilled nursing facility care, hospice, and home health services. The great news for most people is that Part A is completely free, as long as you or your spouse paid Medicare taxes for at least 10 years, which is 40 quarters of work. That's most working Americans, so there's really no reason to delay signing up for Part A. Part B is different. Part B covers your doctor visits, outpatient care, preventive services, and medical equipment. In 2026, the standard monthly premium is about $202.90 per month. Now I know that sounds like a lot, but here's why you don't want to skip it. If you delay Part B when you're supposed to enroll, you'll face a permanent penalty that gets added to your premium for the rest of your life. We'll talk about that penalty in just a moment. What if you're still working at 65 and you have health insurance through your employer? Here's the rule. If your employer has 20 or more employees, your employer plan pays first, and you can delay Part B without any penalty. You'll have what's called a special enrollment period, 8 months after you leave your job or lose that coverage to sign up penalty-free. However, and this is important, if your employer has fewer than 20 employees, Medicare pays first, which means you should enroll during your initial enrollment period. Let's talk about the late enrollment penalty, because this is where people get hurt. If you miss your enrollment window and don't have a valid reason for delaying, Part B adds a 10% penalty to your premium for every 12-month period you were eligible but didn't sign up. And here's the scary part: that penalty lasts for the rest of your life. So for example, if you were eligible for 3 years and didn't sign up, your premium goes up 30%, permanently. Don't let this happen to you. This is also the same for Part D, prescription plans. It's best to enroll into Part D even if you have employer insurance. If you did miss your window and don't qualify for a special enrollment period, don't panic. There is still an option called the General Enrollment Period, which runs every year from January 1 through March 31st. If you enroll during this period, your coverage begins the following month. You may still face a late penalty, but at least you can get coverage. Better late than never. Let's do a quick recap. You have a 7-month initial enrollment period around your 65th birthday. Sign up early to avoid coverage gaps. If you're still working with employer coverage, you may qualify for a special enrollment period. Miss your window? The general enrollment period is January through March each year. And always, avoid the late enrollment penalty. It's permanent and it adds up fast. If you have questions about your specific situation, just message me in the